Hello, good morning, good evening, everybody. I'm Dr. Asavari Manvikar. I would like to welcome you all to the CAR Council for Ayurveda Research Global Webinar Research Series. Council for Ayurveda Research is an international non-profit organization based out of USA with its sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to educate, encourage, and facilitate basic clinical and disciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So please do consider to join us as a volunteer, and we can place you in a variety of projects based on your skills and interest. Once again, our website is www.ayurvedaresearchusa.org. Now let me introduce our platinum sponsor, Komal Herbals. It's a company based in Pennsylvania. It's focused on the concepts of Ayurveda and the power of being healthy using herbal and natural products. Komal Herbals worked hard to find premium ingredients for their herbal formulas. They also source herbs and spices that are sustainably and organically grown around the world. For more information, go to komalherbals.com. Now let me introduce our eminent speaker today, Professor Dr. Sheetal Asutkar. She is MD, PhD in Shalya Tantra. She works as a general anorectal surgeon and a consultant for pain management. She is also a consultant as a leech therapist. She is head department of Shalya Tantra, Mahatma Ayurved College, Hospital and Research Center, Salod, Wardha. She is also a PG guide and PhD supervisor. She is a member secretary of IEC MGA CHRC Salod, Wardha. She is a member special interest group research SG DMIHER chairman boss. She has worked as an ex-head department of Shalya Tantra, Datta Meghe Ayurvedic Medical College, Nagpur. She has operated thousands of having surgical diseases as service to humanity. She has worked more than 22 years and she has a great teaching experience. She has done like more than 50 publications in national and international journals, published 4 books and 5 chapters. She is on Ayurveda Advisory Board of Hungarian Ayurveda Medical Foundation from 2020. She has extraordinary performances as guest speaker on parasurgical and surgical conditions have been appreciated globally. She has completed doctoral research work on study of inflammatory markers in patents of arthritis treated by leech procedures therapy in 2019. She has organized 20 mega conferences and 6 workshops on national and international level in capacity of organizing secretary. She has chaired various sessions in national and international conferences. She has achieved Best Teacher Award in 2020 and 2021, Young Dynamic Speaker Award in 2021, and Dhanvantari Award in 2020 by Ayush Darpan Foundation of India. She is a life member of APA, Ayurved Proctology Association of India. She is a life member of NSA, National Sushrut Association of India. She is a life member of NEMA, Proctology Society Maharashtra and NEMA Maharashtra. She is a core committee member of NEMA Women's Forum, Maharashtra State. I welcome you, Dr. Sheetal. Now the forum is open for you.
Thank you. Thank you so much, Asavari, for introducing me to Global Council for Ayurveda Research. And this is such a nice platform to know about globalization of Ayurveda, one can say. And you people are taking a lot of efforts. So thank you so much for giving me this opportunity to be presenting my views on Dinacharya Upakram from Ayurveda, which is called as daily regimen, which is helpful for the individuals and how it can be implemented in today's era. It seems difficult to follow daily regimen, which is advised by acharyas, or you can say the ancient holistic science, which is called as Ayurveda. It seems difficult for today's individuals how to follow it. So there is a presentation from my side. I have taken efforts how it is implementable or how it can be executed to control the diseases, to lead the normal lifestyle, to have the swasth lifestyle, which is called as the healthy lifestyle. So I am trying my through my presentation. So just let me share my screen, and I'll be starting with it. And how it is helpful in controlling the communicable as well as the non-communicable diseases that will be shared through this presentation of mine. So is it visible?
Yeah. It's visible. Yep.
Okay. So this is the first slide, which is reflecting the institute where I am practicing Ayurveda surgery, Mahatma Gandhi Ayurveda College, that is Medical College, Hospital and Research Center, which is situated at Salod, Wardha, just say 100 kilometers from Nagpur, that is central India. It is situated in, and we are practicing the principles of Ayurveda in this institute. So I have done my post-graduation in surgery and my doctoral degree in even surgery, Ayurveda surgery. Presently doing fellowship in pursuing this fellowship in Ayurveda oncology and head department of Shalya Tantra. I have additional charges as PG convener and PhD mentor supervisors at this institute. So if we go for introduction, today's topic is implementation of Dinacharya Upakram in present era. So this is Dr. Sheetal Asutkar from this side, and all of us as Ayurveda graduates, we have been knowing Dinacharya as the Dine Dinacharya. That is the principles of practicing of daily regimen throughout the day. So Dine Dinacharya or Dinasya Vacharya Dinacharya, whatever we are trying to practice through our daily regimen. So either the things which we are practicing or we are trying to practice, and Charanam Charya, that is the parts of the things which are we are trying to practice through the daily regimen. So in the daytime, whatever we are practicing, Charya means the duties or regimens or actions to be carried out. So all these are termed under the term Dinacharya or daily regimen. And then as we say that Prayojanam chasya swasthasya swasthya rakshanam aturasya vikara prashalmanam cha. So if this is the motive behind following the Ayurveda regimen, so which leads to the daily lifestyle, being the swasthya vyakti, means converting the individual to the swasthya vyakti or healthy individual, we can say. So Dinacharya Palan or the adaptation of daily regimen according to Ayurveda principles also has the same motto. That is, the person or the individual who is practicing dinacharya will definitely lead to the healthy lifestyle after following it for the daily life, or you can say regularly if he follows it. And it is again going to prevent the occurrence of diseases, that is the aturasya vikara prashamanam. So the both the important prayojan or the motto behind following the Ayurveda lifestyle, that is Swasthasya Swasthya Rakshanam and Aturasya Vikar Prashanam, both will be achieved by the adaptation of dinacharya, which is very important to understand. And ये जब हम daily इसको follow करेंगे, so if you follow it daily, then जो आपको विकार नहीं हुए हैं, means अजातानाम विकाराणाम अनुत्पत्तिकरम, the diseases which you feel you should not have, even that motto can be achieved through the adaptation of dinacharya practices. So it can be true about the communicable diseases, like the latest example being the COVID-19. So dinacharya palan or daily adaptation of daily regimen according to Ayurveda is definitely going to help the individual in the prevention of diseases like communicable diseases as well as non-communicable diseases, and the mental health of the patient also, or the individuals also, can be restored along with the healthy well-being. So these are the multiple benefits, how it is possible, that we are going to learn in the coming slides. So maintenance of the harmony between the dosha, dhatu and mala is the basic thing which can be achieved with the help of dinacharya palan. So if you go through this slide, this is very much helpful to understand that what are the points to be considered under the dinacharya palan. So have a look. So there are various things, various fundamentals of dinacharya, which starts from the pratak kale uttishta or brahma muhurte uttishta, which is called as, then shaucha kriya, means you have to wake up early in the morning, that is in the brahma muhurta. Then shaucha kriya, that is you have to get rid of the vikar, whatever the body is having, like defecation, micturition, all these things need to be done in the early morning whenever you get up from the sleep. Then ushapan, some sort of some amount of the things like the liquids, or you have to adapt at that particular time of the day, that is called as ushapan. That is in the morning hours, early morning hours, you have to have certain amount of water. Then danta dhavan, that is cleaning of the teeth along with the mucosa and the oral cavity, which is covered under the danta dhavan, jihva nirlekan, that is the cleaning of the tongue. Then anjan, that is application of anjan, which cleanses the eyes of the individuals. Then nasya therapy, that is intranasal therapy, it is called as, that is it is instillation of some drops of oil within the nasal cavity, and it is definitely called as the, which leads the transmission of the drugs through the oil base from the nasa to the shirasodwaram, that is till the brain. Intranasal therapy, which leads to delivering the drugs till the brain. Then gandush dharan, abhyanga, gandush means it is oil pulling therapy, one can say, and which leads to various covering the various disorders, various diseases like non-communicable diseases, like some sort of CA and all. We are going to have the look details of it in the coming slides. Then abhyanga, which is called as massage therapy. Vyayam, which is called as the everybody knows vyayam, what it is. Actually, it is the physical therapy, you can say. What exactly it means, we will be detailing in the coming slides. And many other things like tambul seven, then dhumapan, and many other things are covered under the daily regimen. So these are the basic things which one needs to follow as a dinacharya upakram. And if you have a look at this, so this is the global data. excuse me. Yeah, I think it is visible. So if you go for the global data, so this reveals that since 2019, there is a, there are certain, excuse me, there is some, just a minute. Yeah. So this particular slide reflects the global data of communicable as well as non-communicable diseases. And the blue area denotes the non-communicable diseases like diabetes, hypertension, cardiovascular disease, then cancer, chronic respiratory illnesses, autoimmune disorders, and heart diseases, strokes, etc. And the pink area denotes the communicable diseases like malaria, dengue, HIV/AIDS, skin diseases, STDs, typhoid, tuberculosis, COVID-19, influenza. So look at this. If you go from 1990 to 2019, so the occurrence of non-communicable diseases is found to be increasing, if you see. So this is the thing which needs to be understood, that the communicable diseases, apart from the COVID-19, other diseases are towards the decrease, and the non-communicable diseases are towards the increase from the 1990s to 2019 and furthermore. So this is the era where the lifestyle disorders, you can say, have increased. So what are the causes behind this? If you go for this, you can see the red or pink area, one can say neonatal disorders, respiratory infections, enteric infections, HIV/AIDS, nutritional deficiencies, they are towards a somewhat decrease. And other diseases like musculoskeletal disorders, mental disorders, respiratory diseases, then cardiovascular, cancer, all are on the rise. Maybe this is a great question mark. What is the cause of all this? It is just due to the changing lifestyles and the exposure to gadgets, exposure to stress. These are all the causes why these things are increased. And you can see the gray area, like this particularly contributes to the injuries. So this contributes to, excuse me, contributes to self-harm, interpersonal violence, then you can say transport injuries, then unintentional injuries, some things like trauma and burns, and many other things. So these are constantly going from 90s to the 21st century, even 2020, 21, 22, 23, we are in 23 now, but the things are on constant levels. But then the area to worry are the NCD, or the non-communicable disease. So what are the limitations of current treatment modalities in treating the NCD? If you go through this, so first and foremost is the high recurrence rate. It's even if the modern science is offering treatment for diabetes, hypertension, cardiovascular diseases, strokes, or many other things like cancer and all, there is a high recurrence rate. So this is the first and foremost challenge in treating. Second is the cost of the treatment. So you can see the various treatment modalities available for various treatments, various diseases. This is particular non-communicable. You must know that these are all the expensive treatments. Whenever it is not as such very much easy for a normal individual, for a below poverty line individual to go for these treatment modalities in India on a regular basis, as it is called as. Some of these diseases are like kashtasadhya, you can say, or some of these diseases are yapya, or some of these diseases are asadhya even, you can say. So the cost of treatment matters a lot. Then adverse and side effects. Every treatment modality, whatever the patient is having for cardiovascular disease or any other disease like diabetes, hypertension, is spreading some side effects or adverse effects on the body. And it is like they say that, yeah, that drug is going to give this to you, if somebody is taking corticosteroids for skin conditions, it is going to produce hypertension and diabetes in that patient later on in his life. So these are certain amount of side effects. Or if some person is going for a chemotherapy regimen for a malignancy, so that is highly cytotoxic drugs he has to consume, and then it is going to give him lot of side effects like mucositis, then like hair fall, then skin rashes, reactions, fungal infections and all, and many more. So these are the things which needs to be like considered. So this is like you have to consider that this is going to happen, and this is not in favor of any individual who wants to lead a normal life, a healthy life. Then that treatment protocol even are not suitable for all. Ayurveda speaks about Prakriti Parikshan and treatment according to Prakriti, or one can say nowadays, which is the era of personalized medicine. So Ayurveda is sort of a personalized medicine and not the allopathy medicines, which are not suitable for all, but the persons go on consuming anti-diabetic, antihypertensive drugs for lifelong, and they face so many problems later on. Then invasive, if somebody has to go for surgical treatments, me being from surgery field, I must say these are invasive treatments, and even they are not suitable, or you can say they are not beneficial for everyone. So it needs to be, you have to be very, very particular in performing the surgeries, and you have to be very much careful also. Then lifelong medications, the person has to take it for lifelong, and maybe sometimes the person gets stuck to these things and then stops taking medicines on their own. So this is the worst part of all these things. And interference in the quality of life due to lifelong medications, definitely. One has to means like diabetes, I am diabetic, or somebody feels like if he or she is diabetic, it means ek level lag jata hai. The person is labeled as a diabetic and hypertensive, and they talk like जैसे कि means Baba Ramdev also always talks like this, ki how one can say that this disease cannot be cured for a lifetime. So somewhere that hampers the quality of life of the patient. It is always there in the mindset of the patient that I am diabetic and I have to take this medicine. If I don't take this medicine, it is going to somewhere harm me for lifetime. ये मुझे kill कर सकता है, ये मुझे मार सकता है. This is the thing which is always there in mind of the individual, which always hamper the quality of life of the patient, and the mental and physical well-being also is affected. So how dinacharya is the probable solution in the current scenario to deal with all these elements? So prevention is better than cure. This is the basic fundamental which we all are aware of. And there is a shloka or verse from Ayurveda. Pathya sadigadarthasya kimaushadha nishevana. If a person follows the pathya fundamental of the Ayurveda, he doesn't have to take any medicines. And pathya asati gadarthasya kimaushadha nishevana. If the person doesn't follow the pathya phenomena, then no medicine is going to cure the person. So it means anyhow the person has to follow the pathya kalpana, which is the part of dinacharya regimen or the daily regimen from Ayurveda, how it is going to help. So if the person is suffering from a communicable disease, which is caused due to the weak immunity, if the person is suffering from a non-communicable disease, which is caused by disturbed metabolism, or if the person is suffering from a mental disorder, which is caused by the modern lifestyle. Exposure to the gadgets is the key to all these things nowadays, and the work and lifestyle of the person, no doubt about that. That is termed as prajnaparad in Ayurveda. It means the regimen which are followed by the individuals daily, knowingly. That is the harm which is done to himself by not following the daily regimens. That means he is doing the crime. Aparadh means crime, and knowingly. Pradnya means buddhi. So the person is doing these crimes according to Ayurveda, and these crimes are done knowingly by the person, which is termed as pradnya parad. And these particularly mental disorders are all the say parinam or the result of this pradnya parad. So how dinacharya is going to help all the three things? So there are certain say fundamentals of dinacharya which are going to correct the metabolism, as well as they are going to strengthen the immunity, as well as going to take care of the mental harmony of the person. So उषपान मुख धावन जीवा निर्लेखन आहार विधि विशेषायतन व्यायाम and nasya. So these are all the terms which will be labeled in the coming slides. They are going to correct the metabolism of the person. Similarly, Brahme Murti Uttishta, Snana, Shirobhyanga, Pratimarshanasya, Tambul Sevan, Nirmal Vastradharan, all these are going to help to strengthen the immunity of the persons, and thereby correcting the mental disorders or creating harmony between the mind and the body, ultimately leading to the healthy lifestyle of the person. So how that we are going to see. So importance of dinacharya, how it is important to follow, why it is important to follow. So dinacharya palan or execution, or one can say adaptation of daily life regimen of a person from Ayurveda is going to help to maintain the hygiene. It regulates the biological clock of the person. It is going to help to rejuvenation of the tissues. It is going to prevent the communicable diseases, strengthening of the sense organs, enhancement of the physical strength, restoration of the metabolism, restoration of mental peace and harmony, induces longevity and delays early aging. These are the multifold actions which are going to help after the following of the dinacharya upakram. So one can say, we can at this particular point of time, we can say that the following of this adaptation of dinacharya practices are possible in present scenario for general public. Means not only for the patients or the rugna or the rogi or the affected individuals, for the healthy individuals also, or for the general public also, adaptation of dinacharya palan is, or dinacharya practices is possible. How? So there are certain hetus, or why we can say there are reasons how and why it is necessary, how it is possible and why it is necessary. So Brahme Murthe Uttishte Swasthya Rakshartham Ayushaha. It is very much important to rise early from the bed. It is said early to bed, early to rise makes a person healthy, wealthy, and wise. Everybody knows. But from Ayurveda point of view, this is the prime thing which needs to be done by an individual. So Brahma Murtha is an auspicious time that promotes physical, mental, social, and spiritual health as well. There is this reference in the coming slides, which is going to tell you that certain important work, if one wants to start, it should be started from the Brahma Muhurta itself in the daily life. So why? Because secretion of cortisol is at peak levels in the early morning. So what is cortisol? It is a hormone which is secreted in the body and which is having its peak levels in the morning, early morning only, which is having anti-stress activity, which is going to control the mental disorders. It is immune modulator also, and it is metabolic enhancer also. So for the secretion of cortisols, which will have beneficial effects on the body, one should rise early in the morning. It acts on the body, mind, and consciousness. So there are certain articles from recent era which show that in healthy, look, the awakening cortisol response, there is an article which shows that in healthy adults, salivary-free cortisol concentrations increase by between 50 to 160% in the first 30 minutes immediately post awakening. Then there is cortisol and immunity by some medical hypothesis. So cortisol, the chief glucocorticoid normally produced by the human adrenal cortex, is necessary for the development and maintenance of the normal immunity. This is very important from being a healthy person. अगर आपको health maintain करनी है तो ये सब hormones का normally secret होना बहुत जरूरी है. So then there is another article which is showing that Brahma Muhurta is an auspicious time that promotes physical, mental, social, and spiritual health, and is the best time to start new project works. And there is then there is blogspot by certain Acharyas in the recent era, and he says that Brahma Muhurta time is 3 a.m. to 6 a.m. daily. It is considered to be the most auspicious time when one can start the spiritual well-being. You can see these are the various articles from where we have taken the conclusion remarks, and which are very important why Brahma Muhurta should be followed. So this proves that various proofs from the Samhitas, clinical studies, famous quotes, sayings of public figures is what should be done. So there are certain instructions for healthy persons. Wake up in Antim Prahar of Ratri, which is the Brahma Muhurta. Then sleep early in the night, eat light food in the dinner, avoid any stress activity, avoid sleep near loud noise area, avoid exposure to light or gadgets, do Padabhyanga prior to sleep, take Nasya in evening time, or agar in any case, in spite of doing all this, somebody has to follow the Ratri Jagaran due to his working hours, maybe night shifts, or like doctors have to go for night shifts and everything, or any computer engineers or IT personals, if they have to do the Ratri Jagaran, then Ratravapi Jagarita Vatam Jagarita Kala Dharma Vishyate Divaswapnam. They say that if the person works for 8 hours in the night, which should be the time for sleep, then the person can go for 4 hours of sleep in the day hours. So 4 hours of sleep in the day hours is recommended for those who go for 8 hours for work in the night hours. So this is the recommendation. Ardham, Kalad Ardham Ishyate. Then, but this is another thing. This is the Sushrut Sharir reference and very important. So in this way, you can cover the Ratri Jagaran, which should not be done. Actually, it is Nishiddha, or you can say which is not recommended for healthy well-being of an individual. But then if you go for Ratri Jagaran due to gadget or parties or stress, then you have to go for Nidan Parivarjan. The patient must not do these things, and Satvavajaya Chikitsa should be recommended in these individuals. So these are the things. Then there are certain another things which we need to follow as Dinacharya regimen. So Danta Dhavan, that is brushing the teeth. There are certain benefits of brushing the teeth in Ayurveda with Ayurvedokta, some particular ingredients like what it does when you do it with Kafagna and Katutik Trasatmak Dravya like Neem, Khadir, Dantadhavan, it is recommended. It removes the organdhya, it apakarsha of Sleshmaisen, increases Annaruchi and promotes Soma property. Means it prevents tooth decay, prevents bad breath, prevents gum disease, it increases the appetite, and it removes the plaque even. So these are all the benefits of Danta Dhavan, that is brushing the teeth. What are the benefits of Kaval or Gandush? You can say that is oil pulling therapy, or pulling the Trifla Kashai through the mouth for certain amount of time. So what are the benefits? It prevents Oshtasputan, that is cracking of lips and dryness is covered, prevents Mukhashosh, that is even dryness of the mouth is covered. Then it prevents the Swaropaghat, that is the, you can say the voice, if the voice is hoarse, it covers that also, prevents Arochak and Asya Vairasya, that is the Ananna Ruchi kehte hain jise, ya you can say the if some persons might be having say these things what you can say, the persons who are not, loss of appetite can be covered with this. Then prevents excessive salivation. That is, these are the benefits of Kawal therapy, modern therapy. The antimicrobial activity they are having reduces plaques, gingivitis. These are the gold standard treatment actually. And to certain amount, certain modern drugs like chlorhexidine and all are used. So one can go for oil pulling therapy from Ayurveda for Kaval and Gandush. And then Jibha Nirlekhan also removes the mala of mouth, eliminates bad breath. That is cleaning of the tongue, which should be done not with plastics or metals, but the drugs which are recommended from Ayurveda. It is going to promote the laghuta, and it is going to give you the appetite for your the food. It eliminates bad breath, and all these are the benefits of these things. These are certain references in favor of all the conclusions which we have given. Oil pulling therapy, which is going to be which is the boon nowadays for the oral decay or some cancer like situations or pre-cancerous situations of the oral cavity, and routinely also why it should be done. We use toothpaste of various companies which are having saccharines, which are having salt, which are using amla rasatmak dravya. So these are not recommended by Ayurveda. What Ayurveda tells you about oil pulling, like sesame oil, you can go for coconut oil, you can go for Triphala Kashai. Tongue coating also had been reverted. It was found to be reverted when these particular therapies were given. Then there are certain decrease in plaque was found. Gingival scores and number of bacteria in the mouth was found to be decreasing after the oil pulling therapy. And then antimicrobial activity was also found from sesame oil, which was effective against S. mutans, which is the bacteria found in the oral cavity. So, and teeth staining, plaque formation also were found to be reduced. And all these are having high scores against the cancer, CEA of oral cavity or post-radiation mucositis like conditions. Or oil pulling helped in 89% of people surveyed and cured of one of more or diseases like all the other things. So these are the surveys which were found after the benefits of which was done for the conclusion of benefits of oil pulling therapy. These are all the articles which we surveyed for all these things, and there is a meta-analysis which gives you so many of conclusions. So ट्रेडिशनल मेडिसिन में इन सब का बहुत बहुत सुप्रीमेसी कोट किया है आचार्यों ने, and it nowadays so many researches are being done. Even my fellowship project is based on oil pulling therapy with virgin coconut oil and certain Ayurveda herbs, and I'm doing a research on this. So conclusion remarks, you can say, if somebody is doing Dantadhavan by toothbrush or wrong material, like as I said, saccharine containing these things, toothpastes and salt containing or amla rasatmak toothpaste, if it is somebody is doing. So you have to recommend the right material to these persons, and herbal tweaks should be used like nimba, then katutikta kashaya pradhan rasatmak dravya should be advised, like khadir, like triphala, vat, and other things. And not doing Dantadhavan, if somebody is not doing Dantadhavan, like those who are having Betty and all these things, so they have to be recommended with Trikatu, Triphala, Kushtichurla, Trijatak oil or Sendhavlavan like conditions, like recommendations to be adopted. Then Gandush. If somebody, why does Gandush with chlorhexidine? There is nowadays there is a trend of having oral rinse with chlorhexidine. So you have to make them aware about the beneficial effects of oil pulling, which is so much beneficial to chlorhexidine. So you have to make them aware of these things, because chlorhexidine has got some side effects, adverse effects like dryness of mouth, sores in mouth, and another things. Who does Gandush with inappropriate liquids? So you have to recommended types of decoctions, oils according to their prakruti. And if who doesn't do Gandush, some individuals who doesn't do Gandush, you have to go for good marketing, spread awareness in educated society. So brands are there, certain brands are there who do Gandush, Kaval, and we have got some pictures in market about of some film stars and individuals doing oil pulling therapy. So this is going to recommend the gandush to normal individuals. Aajkal brands ka zamana hai. So and then Jivhar Nirlekan, if who does, but with inappropriate material. So you have to tell them that tongue cleaners which are made of metals or plastic should not be used for tongue cleaning. In spite, you have to go for the herbal twigs or some materials which are friendly to the body. And you have to spread awareness to them about tongue cleaning, so that dinacharya palan should not be means it should not look that difficult to individuals as they seem to be it having that particular difficulty in doing. So you can see in the first picture itself, um, Anushka Sharma, who is a heroine in Indian cine industry, she is swishing the mouth with oil. So certain oil pulling therapy she is doing, and she's branding for some brand, or I think she's endorsing some brand. So you have to go for, you have to make these things as a brand. You have to introduce things as some celebrities doing these things, so that it will be made common for public. Then you can go for these things. You see the Indian market recommending these things, twigs or some herbal material for this is the dantadhavan and all, you can see. And these particular things in US, you can see some person who is marketing the things for certain means particularly he is having that packet in his hand, and it is branding, he is branding that thing, and it is very much costlier there. So these are the things which we need to be educating people about this. Then you can see the Colgate brand which is having this oil pulling, Veda Shakti oil pulling. Then there are certain other brands also. There is some people are using sesame oil, and others are using coconut oil for the same. And this particular metal tongue cleaner also is shown in the picture. And this should actually copper metal cleaner it is there. And so herbal or copper things can be used, but not other metals and other things. So you should educate the people and about these things. And the next point is abhyanga or massage therapy, you can see. So why it should be done? Abhyangam acharan nityam sajarashram vataha drushti prasada pushtayu swapna sutva dardyavrut. So why abhyanga or why massage therapy? Why people should do it? So there are so many references, so many benefits, like it pacifies vata dosha, it prevents many neurological disorders, Jara, Shrama, Vata. Those who are having Vata disorders like Vata Vyadhi, one can say, then it prevents the early aging. One who is tired, दिन भर काम करके जो थका है, उसको, then Drushti Prasad nourishes the entire body. One who goes for massage daily is having to have all these benefits, nourishes the entire body, delays aging, lubricates the joints, increases circulation. So these are all the basic benefits of massage therapy. Why massage should be done and how it is going to benefit you. So sleeplessness, insomnia is a disorder of the youth nowadays. If you go for the lifestyle, if you follow the lifestyle of young individuals nowadays, you can see that they go for, they don't go to sleep in the recommended sleeping hours. Nobody. All they go to sleep after 2 or 3 in the night only. So this sleeplessness phenomena is common in the youth nowadays. And this is leading to mental disorders. This is leading to depression, anxiety, hypertension in the young, diabetics in the young. So these all individuals are having the deficiency of sleep hormone, one can say. So what is the sleep hormone and how Abhyanga is going to help these individuals? So one who does Abhyanga regularly. So how it is going to help? This is called as massage therapy. It is going to increase the lymphatic drainage, and amino acid like tryptophan is increased. This increased tryptophan in the blood flow is on the higher side after the massage therapy. Subsequently causes a parallel increase neurotransmitter, which is called as serotonin. These serotonin causes the pleasantness effect or the calmness effect on the body. So massage increases the secretion of serotonin, which is a precursor of melatonin, and therefore induces sleep. Melatonin is called as the sleep hormone, and this particular insomnia in the young and the young generation or the elderly generation nowadays is due to the deficiency of the melatonin or sleep hormone, which is induced by the abhyanga, which increased by the abhyanga, and which normalizes the circadian rhythm of the body. So this is supreme benefit of massage therapy one can see, and that's why it is very, very important to go for massage regularly. So there are certain researches which are done. They are giving you the profound benefits of massage therapy. So our first case report concludes that Akal Jara can be managed by Shuddha Balatel Nitya Abhyanga. That is, the Balatel regular massage is going to control the early aging in the individuals. Then another is standardized scalp massage is a way to transmit mechanical stress to human dermal papilla cells in subcutaneous. So hair fall is a common problem nowadays. It is going to be taken care by the massage therapy. Hair thickness was shown to increase with standardized scalp massage therapy. So the massage therapy, that is scalp massage therapy, was standardized and it was used and rendered results you can see. Then there are another say studies also, which one is very important. The number 4 study you can see, a single 10-minute session of the head massage therapy can effectively increase total variability within the cardiac autonomous nervous system to 20 minutes after head massage therapy, while reaching statistical significance at 10 minutes. So it is going to help you to the regulate the cardiac autonomic nervous system also. So this massage may have a more prominent effect on the peripheral nervous system also, which is the component of the autonomic nervous system. So this is a very important finding of this particular research, you can say. And it is another thing concludes that perinatal period massage also is going to help, which is done by the mother herself. It is going to adjust the circadian rhythm in the nocturnal period in full-term infants. So there is a routine procedure of performing massages to the newborns in India, and it is helpful in adjusting the circadian rhythm in them, because it was found that certain neonates, they are very much active during the night time. But when this particular type of massage was done for regular periods, so the neonates are also found to be adjusted to the circadian rhythm. So there are these are certain articles which we referred for all these things. You can see even foot massage, Padabhyanga, also is going to induce the sleep at night time. If one does the Padabhyanga or the foot massage therapy, which is recommended in Ayurveda, so you will experience, definitely you will experience going to sleep earlier in the bed. If one is having headache also, it is going to help in the treatment of headache also, along with the Abhyanga, along with the Nasya therapy. So combination of these therapies are going to help to the individuals. So these are certain concluding remarks you can say. So how it is going to help? So those who can do Nitya Abhyanga, educate them about proper methods and oils. What should be used according to the Prakriti, according to the need of the individual, especially head, ear and foot oil massage. It is definitely going to help. Shira Shravan Padeshu Tam Visheshena Shirayat. This is the thing which is recommended in Ashtanga Hridaya Sutra Sthan, and especially for Abhyangam Acharan Nityam Sa Jara Shrama Vata. So Jara, Shrama and Vata's disease. So this definitely, that is geriatric population, it should be done regularly in them. Or if somebody wants to prevent the Jara, that is early aging, also it will be prevented by Abhyanga. And Shrama, that is one who is tired, one who has worked hard for the day hours, should be doing the Abhyanga, and particularly in the head, ears and the foot. These are the points where it should be done. It relieves stress and promotes good sleep. So these are the points from the Dinacharya which are going to help the each and every individual will be benefited with the Dinacharya regimen adaptation in this particular way. In scientific approvals also we have got for the adaptation of Dinacharya. You can see the Vyayam, which is one of the most important fundamental of Dinacharya. So why it should be done? Shariraya sajananam karmam vyayamam sanjitam. So जिसको करने से इंसान को थकान महसूस हो और जो अर्धशक्ति किया जाए, लाघवम कर्म सामर्थ्यम दीप्तोग्निम मेधसम क्षय विभक्तम घनगात्रत्वम व्यायामम दुपचायते. So these are the benefits. You will feel लाघव, कर्म सामर्थ्य, इससे आपको लघुता का अनुभूति होगी, लघुता की. It means it is going to feel lightness in the body. It is giving you the confidence to perform your day-to-day activities. You are going to feel the Diptogdi, means you are going to have the increase in the food appetite. You are going to have the Shaya, means obesity loss will be there, fat loss will be there from the body. And then all these things, this is going to be beneficial for you after the performance of exercises or Vyayam, assisted exercises one can say. So these are certain benefits of Vyayam. Regular physical activity reduces the BP of individuals with hypertension. Then the there are certain studies which are recommended to be followed. That is structured exercise training consists of aerobic exercise, resistance training. Both combined is associated with HbA1c reduction in patients with type 2 diabetes. So this is a scientific study which is going. So Ayurveda says that it should be performed Ardha Shakti. आपकी जो शक्ति है उससे अर्ध शक्ति ही व्यायाम करना चाहिए. So it is going to benefit you. A low intensity MI counseling also intervention is effective in bringing out long-term changes in the health related outcomes with CVD risk. So these are all the benefits of Vyayam you can see, and who should do, how it should be done. So those who have time for Vyayam, gym. Nowadays, Vyayam is somewhat confused with gym. Gymming doesn't means Vyayam according to Ayurveda. Gymming is a trend nowadays. आजकल इंसान खुद की शक्ति को असेस किए बिना जिमिंग करता है. It is a trend, it is a fashion, one can say. And अर्ध शक्ति व्यायाम का जो फंडामेंटल आयुर्वेदा में बताया गया है, that is not followed. So that has resulted इंसान की स्लिप नहीं हो पा रही. द पर्सन इज नॉट हैविंग प्रॉपर स्लिप, जो कि 6 to 8 आवर्स आयुर्वेदा में रिकमेंड किया है. प्रॉपर साउंड स्लीप नहीं हो पा रही है, इंसान का थकावट नहीं जा रही, डेली रेजिमेन का पालन नहीं किया जा रहा है, एडाप्टेशन इज नॉट प्रॉपर, एंड देन ही इज गोइंग फॉर व्यायाम. सो देयर आर सर्टेन डेथ्स फ्रॉम द सेलिब्रिटीज nowadays. We have witnessed the death of certain celebrities, certain superstars, because they didn't follow the daily regimens of Ayurveda. They just went for the fitness, the over gymming exercises, and not properly following the diet regimen also. This is the conclusion. So gymming के पहले लोग कुछ प्रोटीन शेक्स ले लेते हैं या कुछ खा पी के व्यायाम करने जाते हैं और 2-3 घंटा जिमिंग कर रहे हैं. This is not the way. It is अर्धशक्त्या निशव्यस्तु बलिभिः स्निग्ध भोजिभिः शीतकाले वसंते च मंदमेव तदोन्यता. शीतकाल और वसंत में या ग्रीष्म काल में, शीतकाल और वसंत में आप कर सकते हैं, बट ग्रीष्म काल में आपको उसको कम करना है. या अर्धशक्ति व्यायाम का रूल है. इट इज, you have to spread this awareness among the normal public, the general public. Benefits are for mind and body and soul. Lightness in the body. Yoga is one of the vyayam which is recommended for the individual. Yoga and pranayam. This is going to help you physically and for mental well-being also. Those who don't have time for vyayam, they can go for, they means what they can do now, they can go for avoid using lifts, use stairs instead, stretching exercise in the break time, rope skipping they can go for, used to go for walk for short distance, swimming they can go for, and they can go for walking. If not possible, they can go for 100 steps after the diet. So these are the things to be recommended who can't go for vyayam regularly. Then nasya, this is a therapy. Do wounds zindagi ki, one can say, and pratimarshanasya is such a thing which is recommended for the maintenance of health. And there are certain references you can see. All the urdhva jatru vikar can be covered with the nasya therapy, nasahi shirosodvaram, and these are all the benefits of nasya therapy recommended here. So nasya increases immunity, prevents upper respiratory tract disease, and this is the best example which was recommended in COVID-19. So even All India Institute of Ayurveda, which is the apex institute in India, they had included the Pratimarshanasya in their Ayuraksha kit. So these are all the benefits of nasya therapy, and these are all the kala for nasya, when it can be given during the daytime and night time. So you can give Pratimarshanasya any time in the day hours or night hours, you can see, before going to sleep. So what are the benefits? It is going to cleanse the channels, relieve the fatigue, and improve the eyesight. Whenever you give it, you can see this slide is self-explanatory. So this is the Ayuraksha kit, and you can see the Anutaila Nasya, which was included by All India Institute of Ayurveda within it. These are all the benefits of Nasya therapy you can see. So there are certain important articles like Glasgow's coma skill showed improvement in 2 sittings of 15 days in verbal response, motor response, and eye response in the patients of Pakshaghat, you can see. Then Nasya is beneficial in Urdhva Jatrugat Roga, no doubt about this. There are 15 Kala according to their benefits for Nasya therapy, and Ayuraksha kits include it. So this is the Ayuraksha article also you can see, which was published in elsewhere. And so how it is important to perform and how it is beneficial to perform. So it is easy to administer, requires no assistant, it is inexpensive, it is readily available, less time consuming. Prevention from various diseases and allergic and infectious diseases can be done with the help of Nasya therapy. So all these things go in favor of adaptation of dinacharya practices are possible in present scenario for general public, and it needs to be followed by all for the prevention of communicable as well as non-communicable diseases and the maintenance of harmony of mind and body to take care of the mental disorders. So it needs to be practiced thoroughly. It needs to be practiced by general public, and there are certain recommendations. So promotion by the central and state governments in preventive and curative effect of dinacharya palan is very much important. Rajashray ke bina koi bhi cheez sambhav nahi hai. So this is sort of Rajashray which we need to have. Then various package facilities in government and private hospitals for Panchakarma, for Swasthya Rakshan, and Vasantik woman-like procedures, Nasya therapy, and all. Then it should be insured. Insurance packages of dinacharya procedures should be make available for the public so that it will be in practice. Then Ayurveda college hostel should follow Nasya, Dantadhavan, Prakriti-wise diet, and all. This was the recommendations given by our students, how it can be practiced as a routine therapy in Ayurveda colleges. In SOP of Dinacharya Upakram is recommended. Standard operating procedures we need to have, how it should be followed. Then promotion by proposing National Day for Dinacharya Palan. As National Nasya Day or National, you can say, Vyayam Day, as Modi ji already have started the National Ayurveda Day. So this is also one of the students who recommended this particular thing in favor of Dinacharya Palan. Then by promotion by brands and advertisements, as we have already discussed, and to prevent the patents on recommended drugs or formulations. This is going to, otherwise what is going to happen, our IPR will not be ours. In some coming days, it may be like many of our drugs will be patented in India as well as abroad, and it will not be the IPR of Ayurveda persons. So these are certain recommendations, but anyhow, adaptation of Dinacharya practices is going to definitely help you individuals in maintaining the lifestyle disorders, in prevention of the lifestyle disorders, as well as the communicable and non-communicable diseases. So definitely this is going to be helpful in leading a normal life and in leading the say routine practices, which will be our say motto of going for the daily life regimens, which are going to be healthy for all of us. So this is the thing which we want to take home message will be like, being Ayurveda people, we will be recommending this thing for the general public, so that it is not impossible, rather it is possible to be practiced. So thank you very much for the patient listening, and thank you for giving this opportunity to be on this platform of the Council of Ayurveda Research. And thank you, Asavari. Thank you, Dr. Pratibha, for calling me on this platform and being the part of CAR today. Thank you.
Thank you, Dr. Sheetal. It was excellent webinar, great presentation, very informational. It will be very useful for all the listeners, everybody who is watching this, and for all the students and also general public. It's definitely growing. The awareness is growing everywhere. However, the research behind it, all those articles are very useful, because in the modern era, the data is very important, right? No matter how much is written in the textbooks and reference books, people want the current situation. What is the data behind it? So you have done marvelous job bringing both of these things in your presentation. It was really awesome.
Thank you very much. In the beginning only you said that you are interested in research, so I was very much curious to show about our search, whatever search we have done about Dinacharya adaptation. So I hope you liked it, but then you expressed it with very well. So I'm very much happy that you liked it.
Thank you so much. If I were to ask just one thing, because I see people have really less amount of time, and most of these recommendations are for the morning session. If you see in a Dinacharya section. So what are 2 or 3 things everybody should follow on a day-to-day basis? Because I am Dr. Asavari. I teach here, in a university, as well as so many other students, and also like workshops and seminars. And many times, actually, this becomes anxiety for people to follow all the Dinacharya as recommended, right? So that's how many times students or all the public people, they ask, what are 2 things that we can follow or we should follow? What are the most important things that you would recommend?
Actually, Brahme Murtha Uttishta is the thing which we can do wherever we stay. That is the thing which should be done, because it is going to going to benefit you with the cortisol hormone. So that is very much beneficial. Means you will feel that particular excitement in the morning only, the freshness, once you make it a habit to rise early in the bed. So this is the thing which can be done. anyhow, you start with on a fresh note, and it is recommended to start, as they say, that spiritual awakening, physical and mental well-being will be started from morning itself. So it will be very much beneficial. Secondly, nasya can be done. If not vyayam, nasya can be done in the morning hours. So dantadhavan, jiva nirlekhan also can be done in the morning itself with the recommended things, and nasya therapy. So you can do these 3 to 4 things in the morning hours only before starting your any sort of work. Or even if one has to go for say this means if you have to start your daily routine even in the early hours, you can do these 3 to 4 things, I think. And if one cannot perform the vyayama in the morning, you can go for it in the evening hours also. You can start from walking.
Mhm. Right, absolutely. I mean, start where you are at and, like slow and
Yeah.
like in chunks, because sometimes it is difficult to follow everything. And that's how, yes,
As
work.
it had been recommended in the Vyayama slide, that you don't go for lift, you go for stairs if you don't have time to manage it at home. And you can go for 100, after meals also, you can go for 100 steps only. We call it as Shatapavali. So these things can be done at workplace also. You can go for stretching exercises, not exercise exactly, but go for a 5-minute, 2-minute, 3-minute stretch only during the working hours. Find out some place. And if it is not possible, come to home. You just, after coming to home, you can go for these things.
Absolutely. Very true. This is the best approach for the prevention and
Right.
so inexpensive. Yeah,
Right.
absolutely. This is wonderful. Yeah. So thank you so much for attending our webinar, everybody who attended today. Please watch and subscribe to our CAR YouTube channel to view earlier webinars also and other presentations. Please like, comment, and share the videos. Once again, I invite you to become a member and also fill out our volunteer form. You can now also subscribe to our IU Update newsletter to stay tuned with our projects and our events. If you have any questions, feel free to contact us at ayurvedaresearchusa@gmail.com, or you can reach out to me at asavari@mnayurveda.com. Thank you again. Thank you so much. And I hope to see you again for the next webinar. Thank you, Dr. Sheetal.
Thank you. Thank you very much.